Thanks so much. Welcome, everyone. My name is Jorge Luis Hurtado. I am a foreign physician. I studied medicine abroad. I've been working in the U.S. healthcare system for a couple of years now, different roles, rotating in different hospitals. And right now, I'm with San Isidro Health with a PACE program to carry on with some different trainings and equip you guys as caregivers and direct medical professionals in care of our geriatric population, so we can go ahead and equip you guys with different tools. And well, today we're going to talk about both the circulatory system and arterial hypertension. This is one of the most prevalent diseases and chronic illnesses, not only in the US, but worldwide. So we think it's a good idea for us to go ahead and learn more about this. It's really useful to learn the basics of this disease or illness and how we can actually go ahead and help our elderly patients, right? Now, to start a little bit with some basic materials, I want you all to maybe do this little exercise. Bring out your wrist in between the outer part of your ventral wrist, or the inner side of your wrist, in between the little outside bone called the radius and the tendons in the middle. You should be able to feel a little groove that carries the pulse right there. Hopefully we're all doing it right now, and some of us are getting back a pulse, a little bump in our fingers. Try holding it down. If you can hold it down for 15 seconds, maybe try to get a count of how many times this little bump feels in our fingers. It's just a little exercise to start with what the circulatory system is. Our circulatory system is a pipe system that goes from our hearts to every little piece of our body, every little micro piece of skin, tissue, muscle, organs. This pipe system goes throughout our bodies. And this pulse that we're feeling right now, this little bump, is our heart sending blood, our heart pumping and sending that blood so it can reach where it's needed. Now, if this pulse feels a little bit too high, it doesn't mean we have hypertension. It's just part of the force that carries on through the pipe system, right? This is just an example. These pulses can be felt at different locations throughout our bodies. Most common one when somebody's about to pass out or somebody's unconscious, check for a pulse. We check it here. This is the carotid pulse. It's one of the most strong ones, right? It's a bigger pipe. But anyways, today we will talk about the main parts of the human circulatory system. The main system here, the main organ of this system, the heart, the one that's pushing blood throughout the system. Obviously the blood, which is contained in this pipe system, and the blood vessels, which pretty much are our pipe system that carries the blood everywhere, right? And what we want to talk about, the fundamentals of this disease, arterial hypertension. Too much pressure on the pipe system, if we want to call it that. Now, what is the heart? The heart is a semicircular muscle with 4 chambers in it. This muscle, just like every other muscle in our bodies, it contracts. It changes its shape in a way that it can pump blood out of these chambers. The first chamber, it's the right atrium. So this one is the one receiving the blood, the dirty, quote unquote, dirty blood that's coming from all of our body that carries carbon dioxide, products of metabolism, stuff we don't need, right? It carries to the right side of our body. It arrives there. The right atrium takes it to a bigger space called the right ventricle, which pushes the blood into our lungs so it can be cleared from all of these carbon dioxide, some metabolites. We can put oxygen in there, the oxygen that we breathe. Then from our lungs, it goes to our left side of the heart, which is just like the right side. It has a left atrium that receives the blood from the lungs. It pushes it into our left ventricle, and our left ventricle is pretty much the most important part of our heart. It is the one that carries more muscle. It's gonna push it all the way through our bodies in a rate of 60 to 100 times per minute. That's how many times our heart's ticking. It never stops. Well, until we die, right? But that's what it does. Every minute it's beating from 60 to 100 times per minute, making sure this process that we just talked about happens again and again and again and again. Now, what is the blood? What is this red fluid that the heart is pumping with so much enthusiasm? Well, it has different materials and different components. It's four main components, which are the red blood cells. These are the ones that carry the oxygen, which is the most important thing we have in there, our oxygen, so it can be delivered as a form of energy to every piece and tissue in our bodies. It carries white blood cells, which fight infections, and carries platelets, which are in charge of not letting us bleed out when we trip, when we caught ourselves in the kitchen with a knife, when we're being silly, or when we have accidents, right? These platelets create clots, so we don't bleed out, and this blood stays in our pipe system, inside our bodies, in our tissues where we need it. And plasma pretty much is where we contain every protein, every important molecule and substance that carries on functions in our system, right? So these are the four main components. If we go ahead, we're going to start talking about the blood vessels now, the ones that contain this blood, this important blood, the famous pipe system I keep repeating. So these are the tubes that carry the blood throughout our body, from the heart to every piece of tissue and back to the heart, so it can be washed in the lungs. There are three types of blood vessels, and each one is different, not just in size, but in structure, and obviously on purpose, right? I think we felt that pulse hidden in our wrist just now. That's an artery. We're going to talk a bit more about that in a second. Now, an artery. These are the thickest blood vessels in our pipe system. These are the ones that come out of the heart. These are the ones that the heart is pushing the blood into. So it only makes sense that they're thicker, right? If the heart is pushing this blood with so much enthusiasm, it only makes sense that these have to be thicker. It also makes sense that, in contrast to our veins, these are not superficial. These arteries are the ones that carry the clean blood. These arteries are the ones that carry this important blood that's going to the tissues and not the other way around. So they're hidden in our bodies. The way we find them is looking for the pulse. Looking for the pulse. That's how we see that the heart's actually pumping against this pipe system. Now, from the artery, it reaches all the way into our vessels, into our deep tissues, and it turns into capillaries. What's a capillary? It's a really thin blood vessel that, since it's really thin, the nutrients can actually leave throughout the vessel walls, and they can take the oxygen to the tissues. And these tissues, they're rich in capillaries. Our skin's obviously rich in capillaries, so it can actually grab the nutrients from the blood. Now, the veins, the ones we actually see in our skin, these are the ones that carry the blood from the capillaries once all of the nutrients are taken out, and some metabolism products are put in there, like the famous carbon dioxide that we famously exhale. That's going through the veins. The veins bring it back to the right side of the heart so that it can push it into the lungs. get it clean again, and onto the left side of the heart where it's gonna be clean again and push throughout our body. Now, this we already mentioned. This is just another explanation. We're gonna keep moving. Now, as a recap, the heart, a muscular organ that contracts. It has 4 chambers and it pumps the blood all over our body, right? 60 to 100 times per minute, very important. The blood, 4 main components, each of them different, but very and equally important to our system, and the blood vessels, the famous pipe system. Now, what is hypertension? How does it affect the system, right? Why is it so famous? Why is it so important? We're going to start talking about that. Now, arterial hypertension, it's a lot more than just having your high blood pressure. It's a chronic illness, a disease that it's somewhat uncurable, but really manageable. So we all have different habits. We all have different lifestyles. When we're getting a bit older, when we're getting into the middle of our lives, in the 50s, maybe 40s, that's where it comes up. That's where we start noticing when we go to our doctor, like, hey, you have high blood pressure. It's just amazing. So many people that we know, even ourselves, we get diagnosed with this and we wonder why. So as we were talking about this blood, the pipe system, everything, high blood pressure means that this blood inside our vessels, inside our pipe system, it's pushing too much against the walls. This can mean we either have too much blood or that the pressure inside the system, the walls of the pipe system are contracting. But why does this happen? Different effects, but it sure causes a lot of damage if we don't take care of it. Now, to obviously know what our blood pressure is, we need a manometer, a special device that divides this blood pressure in 2 numbers. We're always wondering, like, okay, one's bigger than the other one, the one on top and the other one in the bottom. So this is one's called systolic blood pressure, the other one's called diastolic. Sorry about that. So what's the difference between the two? Well, the one in the top is the one that we get when the heart is contracting. The one in the bottom is when the heart is relaxing. They're both equally as important. So I just wanted to put that out there so we can maybe get an understanding of why there's a number on the top and why there's a number on the bottom. Why is one bigger than the other one? Well, obviously, when the heart pumps the blood out, the blood comes out with the pressure of the heart muscles, and it's obviously going to be a bit high than when the heart's filling, right? There's usually about a 40 millimeter mercury, which is the measurement unit that we use to measure this blood in our systems. The regular numbers that we should be looking at are around 120 over 80. That's regular. So here on this little table, normal for systolic blood pressure, it tells us it's less than 120 and or less than an 80 on the diastolic. We say we have elevated blood pressure if we have blood pressures over 120 to 129, or still, when it's diastolic, it's always bad to have it over 80. So now we have high blood pressure. We're not doing good. 130 and above. Now, over 140 and higher than 180, that's hypertensive urgencies, hypertensive crisis. And when the diastolic number is over 90, we also want to worry about that. And when it's higher than 120, we might want to take a look. We might want to have a physician take a look at us. Now, what's the difference between a hypertensive emergency and an urgency? These are high blood pressure numbers, usually obviously over 120. Usually when we want to diagnose it as hypertensive urgency or emergency, we're going to see them above 180, both of them. The difference between one and the other is that we're going to find end organ damage. That's when this really is an emergency. But what does end organ damage is? Maybe our kidneys are damaged and we haven't been peeing for like a day, and you're wondering like, oh my God, why haven't I gone to the bathroom? And you check your blood pressure and it's all over the roof. This high blood pressure could have damaged your kidneys. Maybe if you're having some chest pain and you're wondering why would this be, you take your blood pressure's all over the roof, it might be damaging your heart. So we want to get that looked at. That's a medical emergency. We want to go to the hospital and look for potential causes and potential damage from this blood pressure. Now, the urgency is whenever we find these incidental 180s or 160s in blood pressure, but we're feeling just fine, and we may be going to our PCPs, or we might have these patients. We ask them, okay, Mrs. Hurtado, do you have a really high blood pressure? Are you feeling okay? She says, yes, I'm fine. I've been going to the bathroom. I'm not short of breath. I don't have any chest pain or any type of pain. Well, this is a hypertensive urgency. It doesn't appear to be any organ damage, but we still want to get that looked at. So we want to put up an appointment, or also sometimes, depending on the patient, we want to go to the ER. Now, what causes high blood pressure? Why do we get this excess liquid in the pipe system, or this excess contraction of the pipe system on the liquid that we have? There's obviously a lot of factors. Family history, if we have a direct family member with hypertension, that's a little bit of risk. Then, if you're diabetic, having elevated sugar levels on your blood, not good for this pressure. If you have kidney disease, the kidneys are actually the ones that throw out proteins and hormones to regulate this blood pressure, depending on how much salt we're eating, how much water we're drinking. So if we have kidney problems, that can be a cause. Having gestational hypertension or hypertension during pregnancy, this can be transient, but if we had it, we carry a bigger risk of developing hypertension in the future. Having preeclampsia, this is a complication of high blood pressure in the pregnancy. It's obviously going to carry more risks of having chronic hypertension in the future. Hormone abnormalities, thyroid abnormalities, our thyroid, it pretty much balances your metabolism. If it's too high, it might be overwhelming that pipe system with a lot of increased metabolism and increasing your blood pressure. If your body mass index is over 23, if you're overweight or obese, we want to modify that so we don't have an increased risk of developing this illness. Not exercising enough, which amounts to 150 minutes throughout a whole week, is a single risk factor. Smoking, high cholesterol, diet rich in saturated fats, having 2 or more drinks in a day if you're a man, or more than one in a woman. Don't ask me why. We're just allowed to drink more. Sorry. Diet's obviously high in sugar, like we mentioned. Diet high in sodium or salt. Salt has a property in which it pulls liquid, or it attracts liquids. So if we're eating too much salt, we're going to be retaining fluids. This is a general principle. So that fluid is going to go into our pipe system. Too much fluid in the pipe system, it doesn't fit in there. Blood pressure, high blood pressure. Not having a healthy diet, sleep problems, taking birth control in certain patients, but it is considered a general risk factor. Not sleeping enough, so we want to take a look at that. If we're not sleeping enough, or the patients that we care for, we're noticing they're not sleeping enough, let's make it a priority. Obviously, chronic stress, not only a risk factor for hypertension, but it's going to go in the list. Now, complications. What can hypertension do to our bodies? A lot of things. A lot of things. Our pipe system pushing too much blood into our organs doesn't sound like a good thing. Sometimes more is less. So in this case, that happens. What can it cause? Vision loss, stroke, cerebral bleeding. It can damage our kidneys. Our kidneys filter our blood. If we are overwhelming these kidneys with too much blood, we're going to break those filters. End stage renal disease is just when our kidneys are just not damaged, they're already gone. Left ventricular hypertrophy, like I was telling you guys, the left ventricle, the bigger muscle, the bigger chamber, the one that pumps it into our systems. If this muscle is pushing blood against an already filled tank, it's gonna keep growing because it's hypertrophying, it's working overtime. And you might think, hey, isn't it hypertrophy good? Aren't your muscles supposed to be big? Some of them, not this one. The way this one grows, it grows on the inside, so it can only carry too little blood, and then that little amount of blood that now it's pumping, it's not going to be enough for our tissues. And for all of my male listeners out there, it can also cause erectile dysfunction. So we want to take a look at all of these habits that we already mentioned before. And heart failure, when I was telling you about the heart not pushing enough blood, there we go. And ischemic heart disease is the same as a heart infarct, a heart attack. We don't want that. Now, how do we treat this blood pressure? Not all patients require pharmacologic treatment. Like we were mentioning before, all of the independent causes of high blood pressure, if we can modify them, if we can stop smoking, if we can get a balanced diet, if we can aim for those 150 minutes a week, all of these independent factors play a role in high blood pressure. So if we have a blood pressure reading of 135 over 85, each one of these independent factors can play a role in decreasing this blood pressure. It doesn't mean you're going to have blood pressure forever. It's elevated. Why? Because you're not doing all of these things that we have on the screen. We're taking too much sodium. If we limit our sodium intake, guess what will happen? 5 to 6 millimeter mercury, so blood pressure is going to drop down. If we have a healthy diet, that's 11 millimeter mercuries. That it's going to come down. Right there, if you have 135 over 85, and you modify these two things, might as well never take medication in your life, as well as moderating alcohol, losing weight, aerobic and anaerobic or resistance trainings. Different types of trainings, they both impact a lot when it comes to blood pressure. I want to put an eye on that. Now, let's say our elderly patients, they're not really independent when it comes to, or they don't have these abilities to modify their diets. They might not be able to pretty much exercise or modify these things. Those do require pharmacologic treatment. So this, we're not going to talk about a lot, confusing numbers. So who should be treated with medicine? Patients with blood pressures higher than 135 systolic and or 85 diastolic. That requires two different blood pressure readings in the absence of being able to modify all these things that we talked about, of course. And patients with blood pressures over 130 or 80 who have clinical cardiovascular disease, that could be stroke, that could be a heart attack. If you have a heart attack or a stroke and you have these blood readings, I'm sorry. Still try to work out, still stop smoking. Please do not drink that much and take your medication. If you have type 2 diabetes, unfortunately, you also have to take medication if you have these blood readings. If you have chronic kidney disease, of course. And if you have 65 years or more of age, you have to take medication. And also the estimated 10-year risk of a cardiovascular disease of at least 10%. That's a calculator that your physicians use to figure out your risk of having a cardiovascular event in 10 years. Now, hopefully, if you have any questions, I think you're all muted. But if you want to go ahead and put any doubts right now on the chat box, I'll be more than happy to go ahead and answer all of your questions. Also, send us a text message. We can go ahead and give you more information, give you more resources we can continue learning about this disease, how to prevent it, a little bit more in-depth info. If you guys need anything, just shoot us a message and we'll be more than happy to reach out to you. It's been a pleasure. Thank you all for having me and for attending.